My name is Mary Jo. I studied the book Drinking, a Love Story by Caroline Knapp. Caroline suffered from alcohol use disorder and presents a fairly uncommon view of quite a common disorder, more commonly referred to as alcoholism, but it affects about 7% of the entire worldwide population. It usually presents in people of lower economic class and generally affects men twice as often as women. Not only is Caroline obviously a woman, but she grew up in an upper middle class family, which often left her feeling that she didn't fit the docket to be considered an alcoholic. Caroline grew up in Cambridge, Massachusetts. Her father was a well respected psychoanalyst who taught at Harvard University. Caroline went to Brown University. She graduated magna cum laude. She went on to be a successful writer. She actually wrote award-winning columns at her job, and she wrote 2 books. From early childhood, Caroline displayed signs of addictive behavior. From the time she could sit up, she would rock, whether she was on someone's lap. When she was able to sit up on her own, her parents had to put padding on the walls because during her nap time she would rock and bounce her head off the walls. As she got older, she realized that the behavior was unnormal, but she felt compelled to do it many times a day, every single day, sometimes for hours. So she continued her behavior in secret until she was about 16, and that's when her drinking had become slightly more prominent. At an early age, Caroline talked about feeling like she and her father had a connection, some core value that they shared that she couldn't quite identify or explain. Um, she felt like he psychoanalyzed her. He would ask her to do free association drawings, and even as a child, she could tell that he was looking for something in those pictures and looking for something that he was afraid was in her. So she wouldn't draw what she wanted to draw. She drew cliche child pictures for her father to draw his own conclusions from. It's very interesting that after his death, Caroline discovered that her father was an alcoholic. She addresses that he would drink every day after work, and it was his way to calm down. Um, but her story addresses 2 of the major arguments for causes of alcoholism. There's the biological issue of genetic predisposition, and then there's the behavioral issue, the more nature versus nurture, and that when he was dying, her father told her that because twins were so hard to raise, he took over caring for her, whereas her mother took care of her twin sister. Generally, in twin studies, if one twin abuses alcohol, then in 54% of cases, the other twin does as well. For Caroline, this was not the case. Whereas she struggled with her alcoholism, her sister never had a problem with that. Caroline was actually often baffled in that when they would be having wine with dinner, she and her father would have glass after glass, and her mother and her sister would have a couple of glasses and then had the ability to say, "No, thank you, I've had enough." Caroline never understood that concept of what is enough to drink, and this was her first instance in seeing that she didn't drink the way everybody else did. Being raised by her father, she had learned that if you are anxious, if you're depressed, if you're uncomfortable, if you're angry, you drink, and that's a remedy to your problems. Whereas her mother never turned to drink for her issues through her husband's adultery, through her husband's death, through her daughter's alcoholism. She would knit and she would do artwork, and she had a much healthier way of dealing with her problems that she taught to Caroline's sister. It was a very interesting family dynamic in that. When she went to college, Caroline's drinking obviously escalated. It was more about the guilt of being with a man who was so unlike her family. Her family was intellectual, they were higher class. Her boyfriend was a simple country boy. He was from backwood Texas, and she often worried about what it said about her family and herself that she was so attracted to a man who was so different from her family. And in order to deal with her guilt from that, she began to drink more. She lived alone at the time, so this began her drinking alone phase. And of course, this was the beginning of her tolerance. around the relationship with this man, she had attempted to control her drinking a few times. Um, she was always unsuccessful, of course, in her attempts to control her drinking. So when she and the boyfriend broke up, she went on sort of a hunger strike. Um, she was just angry one day and decided she wasn't going to eat, but the power that she felt that day and the strength that she felt sort of took on a life of its own, and she developed anorexia nervosa, not in any fear of being overweight. It was more an attempt to control her life. She couldn't control her drinking, so rather than focus her life around drink, she centered her entire life around food and her rituals, and it made her feel strong and in control. Of course, when she was in her anorexia nervosa, she didn't drink as much, but she also could tell that she wasn't healthy, and she would go on frequent binges. There would be moments of clarity where she would realize that she wasn't behaving in a healthy way. She would go out and she would eat and drink, and in the morning when she would wake up, she would be hungover, too full. She would hate herself even more, and she would double down on her rituals with a more ferocious intensity. She eventually went to a therapist who told her, rather than stay home and isolate in her anorexia, to go out and have dinner with friends. Of course, this got her back up to her healthy weight, but in having dinner with friends, she would have pre-dinner drinks, she would have wine with her meal, she would have after-dinner cocktails, and with her weight back to a healthy level, her drinking was back on the rise again. After college, Caroline began a relationship with a man who she felt suited her family a little bit better. He was intellectual and more like her family, but he was very mentally abusive. And when she would drink, they would get into fights. So it was a very strenuous on again, off again relationship. And at some point during this, she started a relationship with another man. And then the being caught between two men, the shame and the guilt involved with that, she drank to deal with those feelings. And then, of course, the guilt and shame of drinking added to the guilt and shame, which, of course, led to a never-ending cycle there. At some point during the 5 years in this back and forth relationship, she realized that she might have a drinking problem, so she went to an Alcoholics Anonymous meeting. Of course, the disease being more prevalent in men meant that she wound up in a room full of men. There happened to be no women in that particular room, so she was very uncomfortable, and she vowed to herself that she would never go back. She considered Alcoholics Anonymous, that was what she thought of whenever she thought of recovery. So it took her quite a while to get out of that mentality. Around the time she went to the Alcoholics Anonymous meeting, they discovered a brain tumor in her father, which led to a very slow deterioration of his mental status and his personality. It was a very stressful time for the family, which led to the rise of Caroline's drinking. She started hiding bottles not only at each of her boyfriend's houses, but at her family's house, which she had never done before. She always tried not to drink around her family. She harbored a lot of guilt in that the day that her father died, she had been drunk, and it took her so long to get out of the house and get to her family that he was dead by the time she got there. She harbored a lot of guilt over that, and then breast cancer took her mother the following year. With both of her parents gone, Caroline's drinking absolutely spiraled out of control, until she was in an accident, and she almost killed her best friend's 5-year-old daughter. Around that time was when she decided to get help and stop drinking. The diagnostic criteria in the DSM-5 lists 11 characteristics that, if presented over the course of a year, lead to a diagnosis of alcohol use disorder. Of the 11 of them, Caroline presented 10 of them. She never did lose her job, which of course enabled her to keep living the lifestyle that she was living. She was able to tell herself that real alcoholics lose their jobs, lose their families, and because she wasn't doing that, she didn't have a problem. But of the 11 on the list, she did display 10 of them, and over several years, rather than just one. Very often she drank more than she intended to. She would set a limit for 3 drinks and then never intend or never know when she would take the 4th or 5th, and then she would black out and wake up so confused about why she couldn't stick to her goals. She would try to cut back and then she couldn't. She spent a lot of time thinking about how she would get alcohol, where she would hide it, how she would hide it. She described the hunger that drove her to the bottle as a hole inside her that she couldn't fill. Her tolerance increased higher and higher. She often drove when she had been drinking, and in blackout states she would forget where she had parked her car, which is obviously very dangerous, but never occurred to her to cut down or not to do that. Finally, she experienced withdrawal symptoms. She would have headaches, she would dry heave, she'd be nauseated and anxious, and by the end of the workday, she would describe her body as screaming for a drink. When she finally did decide to get help, Caroline went to a rehabilitation center. The center lectured Alcoholics Anonymous traditions and slogans and programs, and they did all that during the day, and then in the evenings, they would go to Alcoholics Anonymous meetings. So when Caroline left the rehab, she went into AA, and she was able to stay sober there, but sadly, of the group of about 10 people that were in the rehab center with her, only she and one other friend were able to stay sober. Alcoholics Anonymous focuses on abstinence as the primary focus for recovery from alcoholism, but this is really more for the severe drinkers like Caroline, who had been drinking for years and who could not control it. Other forms of treatment include relapse prevention, stimulus control therapy, cognitive behavioral therapy, which all focus on controlling the drinking less days or drinking less amounts of alcohol overall. These programs really are more effective for the earlier stages of alcohol use disorder, and about 70% of the people are able to decrease the number of days they drink and are generally able to improve their health within 6 months. Caroline herself has been able to stay sober with the help of Alcoholics Anonymous meetings. She has a relationship with her sister and with her family. She is working on the relationship with just one boyfriend rather than being stuck between 2 now. Her boyfriend is stuck by her side through her drinking and through her sobriety, and she now feels a pride from her parents. She feels like they can see her and they're proud of her. And when she first got when she first got sober, she felt so much guilt, like she was breaking the pact between herself and her father, who had bonded over their alcoholism. Through the program, she was able to get over that guilt and feel like she's carrying on the life that he deserved, the life that he would want her to have. She's very happy in her sobriety currently, and it has worked for her, and she is now able to feel honest love and to really connect with people more than she ever was before. She's very happy.